As Covid-19 began to spread across the UK, Essex County Council commissioned 2,000 video carephones from technology and innovation company Alcove. With support from change management consultancy Rethink Partners, this innovative move allowed us to deliver the largest and fastest care technology rollout in history. A year on, as we emerge from lockdown, it's clear how effective the project has been in helping health and care professionals deliver vital services, laying the groundwork for future tech rollouts across Essex.
My name's Hayley Chandler and I am an advanced nurse practitioner working within North East Essex. My main role is assessing, diagnosing and managing patients with long-term conditions within cardiac disease.
My name is Barry Ansley. I work for Notting Hill Genesis, which is a social housing provider. Hamilton Court comprises of 27 one-bed flats. Out of the 27 residents, 15 of them have Alcove Carephones that they use on a regular basis.
Hi, I'm Tracy and I work at Ferriers Barn Day Centre for people with learning disabilities. We are an arts class day centre, so we have several things that happen throughout the week. When Covid happened, the centre had to close, and for a while we were concerned about our members, about how we could communicate with them and that sort of thing. Then we found out about the alcoves and they were a lifesaver because we could video call them, and not everyone can access things like FaceTime.
Since Covid, things have changed dramatically. When we were told about the pandemic, we were incredibly stressed, incredibly concerned about how we were going to be able to treat and manage our patients within the community setting. Assessment of a patient isn't just talking to them. We need to be able to see our patients in order for us to treat them effectively.
The benefits of the Alcove device and the portal for the staff is that we can actually connect with our residents from anywhere in the world, theoretically. It's really enabled people to not be isolated at such a difficult time and to sort of keep them connected with their loved ones.
It's reduced stress, it's reduced time, it's helped save money. We're not driving everywhere to try and see as many patients as we can. Not only that, it's also benefited our patients. Patients haven't been needing to be admitted to hospital for things that perhaps they could have contacted us for. They've been able to call us, we've been able to video call them, and then we've been able to treat them via the video care phone.
There's nothing like actually seeing the person you're talking to. The main thing is the heart nurse, Hayley. She can see me and she instantly knows whether I look better or worse. Oh, it makes me feel great.
To us as staff, it was a reassurance to know that they were genuinely okay. And if they wanted to ask questions, or if they were lonely, we were there.
Over the lockdown, the whole of lockdown, it's been really good, getting in contact with Nikki and Tracy and people like that. You actually get to see someone, and it's not just a voice. It's a face as well.
The impact that the Alcove Carephones have had on our residents has been astronomical in terms of social isolation and digital inclusion.
The tablet is a godsend, really. Barry calls us around about 2 or 3 times a week.
From Notting Hill Genesis perspective, we're really grateful that we've been involved in this project. It's enabled us to offer real value back to a lot of our residents, and it's enabled us to get technology that a lot of people wouldn't have necessarily thought of having themselves, and it's given them a sort of a spur to looking at digital inclusion in the future.
I do believe it's a great way to communicate with the members of the day centre, anybody with learning disabilities, because they are so easy to use and it's a connection with the outside world for them.
I love my job, I love my patients, and more importantly, I love seeing my patients. Using the Alcove Carephone has enabled me to be able to continue providing great and compassionate care throughout the COVID pandemic.